Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria STONE-OZBEK, and tonight we have a very, very special guest with us. Tonight we have Miss TANYA Ambrose. I want to make sure I pronounce that correctly. And TANYA is a nursing assistant and case investigator, and so she's going to be walking us through a day in the life of a nursing assistant. So please join me in welcoming Miss TANYA Ambrose.
Hi, everybody. Thanks for having me, Dr. Gloria.
Welcome. Well, I'm very excited to have you on tonight. I know you got some obligations to do.
Yeah, but I'm here first,
Yeah.
I'm happy to be here.
Tell us a little bit about who you are and what you do.
Okay, every time anyone asks me that question, I'm like, I just do a lot, but I'll tell you, I'm a recent graduate from the Georgia State University here in Atlanta, Georgia, where I got my Bachelor's of Science in Public Health. By day, I'm a case investigator. By night, I'm a nursing assistant. I am a blogger, a podcast host, a president and founder of a nonprofit. And then I'm a birth doula. Again, I just do it all, people. I don't know why, but I'm just passionate about many different things. Like I say, I'm multifaceted. I can do it all, and I feel like my purpose is to be of service. So that's that's what I do. To just be of service, to serve the people. So yes, but I just say I'm a public health professional because it's like it encompasses so many different things. So public health professional,
well-rounded,
with sprinkles of different things. Yes, so that's me.
So tell us about what do you do as a nursing assistant?
Okay, so let me take you guys back just a little bit. I used to work in the pediatric ICU, working with children, that are critical conditions for so many different reasons. And I've been there for a year and a half. Now I work with the older population, or like we call them the gerontology, where you assist them with the day-to-day activities. Some may have like trach care, so you got to take care of those who are intubated, just normal stuff, change, clean, eat, making sure that they are comfortable, because some are usually on hospice care, so you want to make sure that they're as comfortable as possible, on the way to transitioning. And it can be a very hectic job. You're on your feet. I have many back pains. I'm always tired because, like I say, I'm a case investigator by day. So then when I get home, it's just enough time for me to shower, take a quick nap before I go to work at night, and then I just repeat that. Basically every day. There's 7 days in a week, and I do that at least 6. But like I said earlier, my passion is really to be of service to others. So sometimes I would complain about, I'm tired. Oh, I'm always working. Like tonight, I'm supposed to be off. These different things, and I don't know. I just like it. It honestly fulfills me. I know it's cliche to say that, but I really do like seeing the smiles or just a thank you from someone saying, thank you for taking care of me. Honestly, brings me joy. And I hope to be a nurse one day. So all this is practice, for me.
I think that's awesome. So like, what are some of the things that you have to do as far as like, do you have to take blood? Do you have to what are some very specific things you would say that?
Well, yeah, I do take blood because, I am a certified phlebotomist as well. Forgot to mention that again. Like I say, people, I do a lot. So that is one thing, taking blood, making sure that that's the feeding pumps or the IV, make sure that they're full or need to be replaced. And, I've had the privilege of working with great nurses that are willing to teach, especially that they know that I want to be a nurse in the future. So they do teach. So even though some things I don't do on my own, for the sake of HIPAA and the certain rules, you don't want to violate certain rules, but I get to do it in the presence of, some amazing nurses. So I'm learning, I'm getting to do different things that I would normally do in a different setting because, again, they're always willing to change. So, you're drawing blood, making sure that, again, they're eating their food, medications are taken, because sometimes you'll give it to them and they want to swallow it all away or they'll throw it out. You got to go check to make sure that that's being done. Of course, changing them for those who are incontinent, you got to assist with that as well. And of course, chatting, making sure that, you're documenting everything, because someone once wise told me, if you don't document it, it didn't happen. Yeah. It didn't happen. So, staying on top of my chatting and making sure that everyone, give them baths. Because I feel like for me personally, because I've seen that or have experienced that, when you're sick, you want to make sure you're being taken care of the right way. Like if you were home, you want to have your bath, your shower, whatever it is. And sometimes I find that sometimes in a hospital setting, as even nursing assistants or even nurses, sometimes we don't often take the time because you have so many patients, so many obligations as well
Yeah.
to fully, take care. And for me, it's like a priority for me to make sure that I'm giving that particular patient the attention and the time, because how I want to be treated when I'm sick is how I'm treating them as well. And that's something that I think is important, when it comes to the healthcare fee. They're sick, yes, you have more than one patient, but again, they are people, and think about yourself, think about your family members and how you want them to be treated if you left them in somebody else's care.
Yeah, because it's so easy to just be in like robotic mode.
Yeah.
You know what I mean?
Yeah,
Just
it
kind of
is.
going through the motions. But when, like you said, when you think about it, when we get older, we're gonna want people to, take care of us and make sure that, we don't have to want or need for anything. So
yeah, that is true.
that's awesome. I like that. I really like that.
Yeah.
So you also said that you're a case investigator. So for those watching who may not know exactly what a case investigator is, can you tell us a little bit about that?
Yeah, so as of now, I'm a case investigator working with COVID-19. And for me, not to sound any way, but I feel like, as a recent public health graduate with not as much experience in public health itself, of course, from the clinical side of things, I do have that experience. But as a public health graduate, you want to get that experience. And COVID-19, in a sense, came at I hate saying the right time, but, if you understand what I'm trying to say, like it came at a point where, the job market for, I guess, public health, expanded. Because, before that, public health was behind, of like the healthcare professional. We were just like, only the corner. And since COVID-19, it became, in the front. So as a case investigator now, you're able to contact those who would have tested positive for COVID-19. So that's what we do on a daily basis. You get a certain amount. And this is coming from the Department of Public Health. So that's how they keep their records. So the numbers that you oftentimes see on CNN or wherever when they're talking about, X amount of cases in this state or this county, we are in a sense responsible for that because we are interviewing these positive cases, finding out, who are their close contacts. So then that way we can pass that information on to the contact tracers as well. So in investigating them, finding out where they were before they start receiving or having symptoms 14 days prior, did they travel? We're also offering them resources because, sometimes, again, given in this climate, people have lost their jobs or they probably weren't even working before, so it's even much more harder. So we do try to offer them resources. Again, it's funded from the, Department of Public Health in each state or in this state in Atlanta. And offering them resources, making sure we're checking on their symptoms, giving them guidelines to how they should isolate. Because, people tend to get, I guess, mixed up when it comes to isolating and quarantining. If you tested positive, you should not be in any contact with anyone at all for at least 10 to 14 days. If you think you would have been exposed, then that time would be, you should quarantine for 14 days before, going out. And even though, the numbers are falling, people, I want to make sure I say, if you don't mind me, Dr. Gloria, please make sure we're still practicing, social distancing. Because again, some of the people who I investigate on a daily basis, they're like, oh, I've been home all week, I've been home all month or all year. And then I just went to the grocery store and now I'm positive. So, it's something as simple as going to the grocery store when you think you're taking all the precautions that you can get. And, it just takes one time. So the goal as a case investigator, because I'm just running my mouth,
no, you're
is
fine.
to make sure that we are investigating, those positive cases. And we do get those cases that they do come from the Department of Public Health. Because sometimes people will be like, oh, how you got my information? Oh, I didn't tell you I had COVID. And, what I've found since taking this job is that there's like a negative or a stigma to people feel bad if you know that they have COVID-19. And, it's just something that it happens, thank God if, you come out on the right side of it, but it does happen. And, they're recursing, oh, how did you get my information? And, oh, I don't have it. When obviously you're staring at the document right here, you can see, but again,
right.
there's like a stigma attached to having COVID-19. So not all investigations go as smoothly as we'd hope. And sometimes you're not getting accurate information, and that in turn can, again, when you put it in the data as far as that, it's not always accurate. So there's like a misinformation sometimes, which can be so stressful.
Yes. I remember, tell us about, you remember you were telling me you went to a client house
Oh
and had like,
yes.
oh,
So some days we do have field days where we got to go to the house, door to door. And I went. It was this neighborhood. It was in the heart of election days, guys, in November. And we went. And as you can see, I'm an African American, and from the story, I'm sure you can tell where I'm going. But I went to ring his doorbell, and he started cursing, the N word and get off my property. Let me tell you, I was so scared. I just ran back, to the car because I'm not about to risk my life. For
I
someone.
know, just to make sure you're following your.
I'm like, you can go ahead. You can, if you want to go on the street, that's your business, but which is, again, it's sad because, you put race into that, but when you're actually trying to do your job. So again, there's some days when people won't answer the phone, they won't conduct an interview, or if you go in person, you're getting all these, get off my property, you end this, or I don't want to talk to you. And sometimes I've seen, like I said earlier, that when you go, oh, how did you get my number? Oh, I didn't give anybody permission. And you have to tell them, it's from, we're talking to you, we're not sharing your information. Because again, you got to have that HIPAA violation, that HIPAA there, HIPAA code. And it's like, oh, I went to my doctor. How did I get it? I say, as standard protocol, once someone tests positive in whatever county or state, it goes to the Department of Public Health for us to, that's why we keep record and see how we can best slow the spread or even stop the spread. But let me tell you, that day, Dr. Gloria, I told myself, I can't do this. I'm not going to jeopardize. You love what you do, but I cannot, like, my safety, honestly.
Right.
I'm like, some days I just think about it and I just laugh.
Trying to check on somebody with a COVID test.
So he had his dog barking. I was like, we're not going to do this today. But but that's just the kind of people that, you get. And I think in being in this field, you meet many different people, many different personalities. You just have to know how to deal with them. But it can be challenging because some people are, just don't want to talk, and some people can just be mean, like that individual. And like, again, like that's something that when I want to joke, I just think about that because it's just in the moment it wasn't funny. But when you think about how people can just be so, I don't even know what to call it. You just have to just laugh. So you got to find the joy in that crazy moment.
Yeah, I can definitely see that.
Yeah.
So you said that you also find the necessary resources for people who have tested positive. So what are some of those resources? Can you go a little bit more in detail with that?
Some of the resources that we've offered to help with bills. That's things again, it's grant funded. So we've offered to help with bills if you have like electric bills, outstanding rent, whatever it is as far as bills go. We do offer that. If you have to be in isolation or quarantine and let's say you're someone who has to get meds or even groceries, we do offer, there's like a resource coordination team where they put that in place where you can go shop for them, pick up their groceries, pick up their medication and take it to their house, obviously leave it on their doorstep and then they'll be able to have that. We do offer the different toiletries, cleaning supplies, because again, that's also like a big thing. So those are some of the resources that we do offer. So food, pick up groceries, pick up medication, cleaning supplies. And, we just started a program. If you need, like, say you're unemployed, trying to find a job, there is a program now that they're still building, but it's still failing you, that they're trying to place unemployed people, in so that they can get a job, So I do like that aspect of the job because, people are really, like, sometimes you call some people and some people like, oh, I don't want it, which, I guess you're in a different tax bracket, so you don't need it. But then there's some people who are, oh my God, thank you for calling. I didn't even know that was a thing. And, because it's not as advertised, I think, as much as we'd like for it to be, or maybe they don't even have access to even see, these different things. So some are usually grateful, and that's another rewarding part of the job, being that you're actually helping. Like, oh my God, I can get my bills paid. Yep, we can. And, it's like a continuous thing again until, that money runs out from the funds. But other than that, yeah, so those are some of the resources.
So is there a way that is there a website that people can go to check out the resources that you guys offer, or do they have to test positive and then go through?
So you have to test positive. Okay. Once it hits the system or generates in the system, then that's when we'll have their information. And once we complete, because that resource is being offered at the end of the interview. So sometimes some people don't even get to the end because again, they don't, they hang up or they don't want to, they just say, I'm not talking to you. So they don't get to hear that part. So
Right.
sometimes, you got to gauge that conversation because, again, you got to have empathy and just some people are just angry or some people just don't understand. So sometimes you try to lead with, here we can offer you resources, X, Y, Z. And then when they hear that, now they're more willing to answer. And once you tell them that, then you can get the investigation done as well. And in the same time, they're getting that resources. So it's not as advertised on. I mean, I'm pretty sure some people, depending on where you are in the US, you can go to the website, your State Department website, and see if they do have that. And there are some nonprofits around that are also helping. I know for sure over here, there's one that's called CORE that helps with. They work along with the Fulton County Board of Health, the different Board of Health here, and they also assist. With basically the same thing as the County Board of Health. So you can go to the website, but again, it's not as advertised. And if you aren't positive, then the chances of you getting the help or we know that you need the help is not gonna, it's a bit slim. So you have to be positive in that case. But of course, I'm sure there's other resources around for those who just whether you're positive, who've been impacted more or less.
So in Atlanta, where has the trend been going? Have you been seeing a rise or have you seen a decrease?
Right now, there's been a decrease. Well, we'll see because we just had the All-Star weekend here for the NBA, so who knows what's going to happen this week.
Baby, it was paid. Atlanta was paid. That's where all these people coming from.
And I feel like throughout this whole pandemic, first and foremost, Atlanta has been acting like, for some reason, maybe we had the vaccine here since last year. We didn't know because you were just out here in numbers from ever since. But, the numbers, they have been slowing down. Even the numbers for testing have been slowing down because, we have these different mobile unit sites and they've been decreased in testing. But as far as the vaccine, that has been an increase. People are coming to get the vaccine, which is a good thing as well. But, of course, people have their own,
yeah.
There are reasons besides whether they're going to get it or not. But we have seen a decrease. But again, we'll see what happens since last weekend was
we'll give a couple. And
what I've
spring
heard,
break is coming up,
right? So they expect to see a
summer break. So
yeah, so we'll see. We're going to be back in the house in October. We're just going to. I feel like we're just not going to ever leave because we're thinking, a vaccine, let's go, and. Yeah, so we're gonna be here for.
Well, I did read something that was like, if you had the vaccine, they'll allow you to congregate without your masks or something. Something was like that.
Yeah, I think I heard that too.
People with whether they had it or not, they can still spread it if they have it. So I was like, I guess the symptoms may be less, but we don't really know.
Yeah, I'm still gonna be wearing my mask. I'm not taking any chances because there's just so many information passing around. We don't even know if it's gonna work or not. They still wear your mask, people. I know it can be annoying because sometimes I myself get tired of having to wear a mask every day, especially in the office, and it's just like, I just need to breathe or I just wanna, not wear my mask, but. I don't know who's who, and you can't tell who's all vaccinated or who's been getting tested. You just don't know.
Yeah, I know here in next month, I don't know if it's April 4th or April 9th, we no longer have to it's not mandated to wear the mask.
Oh, wow.
So, but it's at your own discretion, like if you want to.
Yeah, because we had that earlier last year. The governor, he lifted that because he had to put it back, but I'm not sure if it's totally gone, but for me and my household, we are going to be wearing our mask. Of course, because I've been going to the parks. So of course, I'll have my mask just in case. But obviously, you got to use again, like you said, your own discretion. But some people are just. I'm like, let's practice some 6 feet here because you don't need to be right next to me.
Back up a little bit. I like the grocery store. They just walk up on you and they want to be all.
Yeah, it's always in there. I'm like, we all trying to get to the next cashier, but you can step.
Right, but I don't like that I didn't like that before COVID.
Right. So can you imagine now? I'm like, what? Give me some space. I don't need for you to be seeing if my card is going to decline or if I'm putting something back. Like, no, we don't need that. Or I don't need for you to see what I'm buying. Like, no. So that was me before, and that's me even now. Even more, I'm like, we're not going to be there.
Now, tell me about your nonprofit.
Oh yeah, so it's called Scrub Life Cares. We officially launched it last November, but prior to that, I was just giving back. Because guys, if you can tell, I have an accent. I'm not sure. I'm trying to hide it, but
no, don't hide it. I love it.
I'm from the Caribbean, this small Caribbean island called Antigua, and since I've been living in this country for the last decade. I think, I've been trying to give back because this is what I've seen my parents do ever since I was born, especially my mom.
Mhm.
So when I moved away, I was like, my God, I'm going to open this state-of-the-art nursing home. But, I'm still here trying to figure my career out, trying to get, in that groove. And I'm like, why wait until wait for the next 5 years? So I started giving back to like this girls' home on my own with the help of like a few friends in my family. I'm like, you know what? Then when I went to Uganda in summer of 2019 for a study abroad, the idea came to my head because, it's like, you see so many people suffering, and
Yes.
we often think that it's only in like Africa. And I'm thinking, we have suffering here in the US, but even back home, there are people in different communities that are, without. So I'm like, I'm gonna start this nonprofit, and I kept delaying because again, I'm like, who am I to start a nonprofit? I'm like, no, it's again, my purpose is to serve. So we went and launched it, created a team, and we're all about, serving those in the underserved communities and, teens, because again, trying to educate them and give them that resources so that they can, at the end of high school, they have something that, they can either go on to college or whatever it is that they may have if they go into the work field right after. Because that's not, that's a bit common in the Caribbean. Like, you leave from high school if you don't go to college because your parents can't afford it. You can, go and do like a trade or find a job. So we want to equip them with their, essentials for life. So
I
that's
love that.
basically, that, it's hard work. I can tell you that. But, when your heart is in it, and the support from people who I don't even know, I didn't even expect, really and truly warms my heart. So the days when I'm like, you know what, who am I to be having a nonprofit? Or I feel like giving up because it's just too hard trying to find funding or whatever. But,
Yes.
it's a
Actually
challenge.
how I've been there lately because I actually have a nonprofit as well. So
Oh,
I would like to partner with you. Mine is
yes.
geared more towards providing free chiropractic care to like
Mm,
poverty-stricken
yeah.
areas, shelters, things like that. So we are actually getting ready to launch it, and I want to be able to give like Black women or
Yeah,
Hispanic
yeah.
women
Mm-hmm.
scholarships like that plan on going into the health field and different things like that. So we are working together right now to get everything
Yes, I
in
love that, Dr.
order. But
Gloria.
I
Well,
would
I'm
love to
here
partner with
definitely.
you.
Yes, that's
Yes.
gonna be. I'm holding you to that. So
Yeah, I'm
it's
serious.
on record. So you can't go. But that's really awesome. Because again, people just need kindness and just to know that someone care about them. Because sometimes we're out here and we just want to hear some. How are you? How can I help? And I feel like
Right.
that goes a long way. And again, there's so many people in the underserved communities that oftentimes gets forgotten. Like people
Yep.
forget about them.
All the time.
So it's up to us. Like I tell myself, because I want to do the work. I'm like, what, Rome was not built in a day. Take it one day at a time. Because they need to help so many people, but you have to be realistic, and that's what I've been
Yeah.
telling myself. One day at a time. Once I get one thing off the ground, you can focus on the other. But I'm really excited. I can't wait. I'm really excited for you. I really
Also,
am.
and you also have a podcast, so tell us a little bit about that.
Oh, yes, I have a podcast. It's called the Tea with Tanya podcast. The tea, because I am a tea lover. Again, I'm from the Caribbean.
I love
We put,
tea too.
yeah, everything. If you have a headache, drink some tea. You got a pain in your finger, drink some. We just, tea is just tea is just a way of life. But yes, I do have a podcast where I talk about public health stories here and there. Talk about wellness, where I'm documenting my journey toward becoming my best self. Because having been taking care of myself, as a student, full, always on the go, and we tend to neglect. So it's all about promoting positive living, wellness, and just, sharing some public health stories. Because I tell people public health is our everyday life. Like the stoplights that we see is public health, the streets that we drive on, all these different things. So,
Yes.
and I do have a passion for maternal and child health. So it is my goal to like educate those in my audience, more about that aspect of things. Because we think about, maternal and child, especially with African Americans, we again are high on that list when it comes to like, maternal death and these different things. I'm just trying to do my part in this world, my small part in this world to just make the world a little bit of a better
Just a
place. Because
little
we
bit.
know, yeah, just a little bit, because we know how this world can be. Okay.
Yeah.
Yeah.
I love that. The next time I'm in Atlanta, there's a cute
Yes.
little tea place I've been wanting to go for some afternoon tea, honey. So I
Wait,
might have to
what's the
call
name
you.
of that?
I forgot. Let me see. Let me see. Can I find it really
'Cause I
quickly?
saw this tea place on Instagram. I forgot what the name of it, and I wanted to try that because I'm like, oh, let me go get some afternoon
Yeah, it was
tea.
like really
Yeah.
nice, and you can make You can make your little reservations and stuff like that.
Yes, I'm just so happy
It
I
was
found
just
someone else
adorable.
loves tea because let me tell you, there are people like, oh, coffee, coffee. I said, no, I'm a tea person because it doesn't do anything for me. Like coffee doesn't do anything. I'm not bashing you coffee lovers, by the way. I'm just saying, I'm a tea girl. Like
I think it's called Mary Mac's Tea Room.
Mary Mac's tea room. Let me see if that.
And they also have like Southern food.
Ooh, okay, I gotta go check that out.
So, so I think it's that
Yeah,
if it's not, because I sent it to my friends a while ago. So if that's not the name, then now when I find it, I'm going to send it to you. But I think
please.
that's the one I was looking at.
But yeah, tea gives me life. That's just me. Tea loving girl, trying to save the world one small step at a time. So that's me.
Absolutely.
Yeah.
Yes. Well, I just want to thank you so much for coming on tonight. Do you have any closing remarks or anything you would like to leave with the viewers?
Well, I do want to thank you for having me on, and I do want to let the viewers know the power of networking. We met in a public health group, and here we are, Facebook friends now, and about to
Yes.
be nonprofit bestie. But so that's the power of networking. People, use social media. I know people say, "Oh, social media can be." Like a negative thing, but you can use social media as you're on Google as well. Like, try to find people that in your respective fields and just try to connect. More often than not, people are willing to connect because, again, we don't think we have people who are interested in us or what we're doing. So I do want to leave that because every time I think about it, I'm like, me, little old me, Tanya's going to be on Dr. Gloria's, live. And, I started thinking, who am I? But, again, I say I'm thankful for you, and I feel like I can go do this now. I can be a public speaker.
Absolutely.
But
Yes.
yeah, but make sure you guys do network because I'm telling you, it really is key. Like that's been my thing all year, all since last year. Networking is key. Using my social media to my advantage because sometimes you can fall off that wagon and be doing other things. But trying to connect, and I am grateful for you for always being kind from the moment I first spoke to you to even tonight. I was so nervous, man. I was like this, no, I'm just relaxed. So I do want to thank you for having me. I really do appreciate it.
Absolutely. I'm so excited that you came on tonight. I want you
Mhm.
to stick around, okay?
All
And
right.
I'm going to give you my number once we
Yeah,
go,
all right.
okay?
No
So
problem.
hold
All
on one
right.
second. All right, guys. So thank you guys for tuning in tonight. Be sure to tune in every Monday night at 7 p.m. Central Standard Time. If you have not already done so, please be sure to like, subscribe, and share this video into our channel, Random Health-ish. Another thing I wanted to announce tonight is if for whatever reason you miss our Monday night show, you can listen to the podcast, Random Health-ish Podcast. It is on Spotify. It is also on Apple Podcasts and a few other platforms. I will be posting the link later on tonight and on the Facebook page. So thank you guys for tuning in, and I will see you guys next Monday. Have a great night.